Today I have with me for us all Alex Gason. And Alex, maybe you could just remind us who you work for and what your role is as well.
Of course. Thanks, John. Yeah, Alex Gason is my name. I work with Fields of Life. They're a Christian development organization working out of East Africa. I'm based in Cork in the south of Ireland, and I work as a developer and a fundraiser down here. So I've been doing that for 5 years now, and it's never the same day twice, which keeps me really interested. And yeah, I really enjoy it.
Good stuff, good stuff. And for folks in Donegal, Ballantrae and Inver, you'll hear the name Fields of Life and hopefully remember our jerry cans that we've had over the last lot of years, helping put money aside for the wells. So, Alex, the reason for doing these interviews is to try to see a wider view of the impact of COVID-19 and the social restrictions that brought across the world as well. I'm just wondering, first of all, from your organization's perspective, from the perspective of Fields of Life, how has COVID-19 affected the working of the organization?
Yeah, thanks. Yeah, it's a big organization. So if I speak maybe from this side of the water, and then perhaps from the East African side. From this side, I suppose quite early on, the decision was taken, obviously, to work from home. So that was quite a bit of planning and logistics to move out of our office in the north near Belfast. There's probably a team of about 11 or 12 there. So there was quite a bit of organising who would do what. And then, of course, there was furlough schemes mentioned, and some people were off, some people were on. In the south of Ireland, you're able to work as well as claim, which is great. So I've been able to work the whole way through that process, and I've been able to work from home here. But I work remotely generally anyway, so for me it wasn't a huge change. But I think for some of my colleagues, it was quite different working from the home space, not having that interaction. And I suppose, just wanted to be safety first was the policy, I guess, both here and in East Africa. So our East African office, we had to close that down as well. And we have a lot of drilling teams in the field and a lot of our school workers in the field. So there's quite a lot of logistics around that.
Yeah. And then you mentioned East Africa there. I mean, you're in a number of countries there, primarily, I think, in Uganda, if I've remembered that correctly. And I just wonder, what has the experience, do you know much of the experience of COVID-19 and safety and all the different things that we've been taught over here in Ireland? How has that impacted the communities that you'd be associated with, that you'd be connected to or serving as Fields of Life there?
Yeah, well, as a group, we decided we had two choices: batten down the hatches or lean in. And we prayed about it, and we felt we should lean in. So what we decided to do was, in partnership with Arup Engineering, we set up a call center, and we took a list of all the well sites that we had drilled. Talking about 800 well sites in and around there, and schools. We have 127 schools. So we put a list together, and then we looked at the geographical region, and then we cherry picked some of those to spread a wide geographical region. And then we built a survey, and then we did a baseline survey. So we called 160 communities across a wide region, and we did a fairly significant survey on day one. And then we followed that up twice now. And that has informed our strategy in terms of response, trying to find out what was actually happening on the ground across that wide geographical area. And it's really informed us that COVID has not been a significant challenge so far, although the numbers are now starting to creep up quite quickly. But in the early days, sort of 8 weeks ago, the real challenges were lockdown, food, lack of access to healthcare. Unfortunately, two of the kids in our schools passed away because they couldn't get access to healthcare for issues that were not COVID related. People wouldn't take them to hospital because of challenges. And I'll just leave it at that. But there are some challenges within that environment. So with that, then we then built an emergency response, and it was an incredible response. Our CEO decided he was going to walk to Uganda.
Oh wow!
Because he couldn't fly there. He was meant to fly there. He decided he wanted to walk to Uganda, and he asked people would they join him on that walk. So a group of people decided they would walk. They've arrived in Kampala now from
Wow.
Ireland, which is quite impressive.
That's
And we
incredible.
raised about
Yeah.
€40,000 or so for
Okay.
that.
Okay.
Which has been great. And then we probably raised another 110,000 with an online campaign. Very light touch, but
Okay.
just letting people know what was happening on the ground.
Yeah.
So we've been able to deliver aid, food, PPE. Food has been the big challenge.
Okay.
So we've fed about 20,000 families so
Wow.
far. We've reached about 400,000 people with hand washing facilities, PPE,
Okay.
soap, those kind of provisions.
Mm-hmm.
But it's been a very targeted response. It hasn't just
Yeah.
been sort of a willy-nilly one. It was very much more, we were calling ahead, finding what the need was, then working with the local government task force, delivering. And then we've actually been able to follow up and see that 70% of the communities that we surveyed had received specific aid through the government process, which is actually brilliant to realize that all of that aid got into communities we were talking about. We're fully convinced the other 30% got into communities, just not the ones we particularly serve, but that's okay too.
Yeah.
You know?
Yeah.
So it's been a really, really practical response, and we've really enjoyed, I guess, being able to do something practical on the ground.
That's great. We posted on our Facebook page the video from Kampala, sort of detailing some of the struggles there, and you'd mentioned about the food and so on being one of the major issues. I guess just to sum up, because a quick interview as such, but to sum up, for our folks, for ourselves here, as one of the church groups that has supported Fields of Life over the last number of years, what can we do to support, to help, and so on, having heard that kind of thing from what you said, from what the video had told us as well?
Something very practical. I suppose there are genuine needs, as in sort of life, and without being too dramatic, sort of life and death needs because of lockdown, because of the challenges. Most people live to work and work to eat daily.
Okay.
And when you can't work, you can't eat. And therefore your kids are hungry, and you're left in a very difficult position. So the lockdown in Uganda, for example, you were confined to your home and your garden. You couldn't come out on the street. There's now a curfew of 7 p.m. every evening. You have to be inside by 7 p.m. So while things have relaxed a little bit, it still makes it very difficult for your average worker. A lot of jobs have changed, or you can't, for example, move down to Kampala. If you went home to live in your rural community, you can't just travel back down that easily. It's very, very difficult to do that. And then where do you stay, and all of those things. So what I might encourage you guys to do is maybe think about a walk to some of our other partners. We've arrived in Kampala, and maybe if the church wanted to walk to, say, Sudan, or Kampala, or walk to Rwanda, that's a lot closer. We're providing support into Rwanda, Burundi, Sudan, these type of other environments that we work in, these other countries. And if you wanted to even be part of that, or help that, or do something like that, you could do something very simple, and you could ask people to fundraise and walk, and it would mean that that money then is provided into those communities. And again, tracking those donations. That's just a very practical way of helping. Please pray.
Just to confirm, is that like, it's the virtual walk?
It's a virtual walk.
Yes,
you can
just to clarify.
You now have Donegal to walk in, for example. So there's plenty of room. We were stuck within 2 kilometers and 5 kilometer sort of restrictions. So we were asking people to do that in their garden, actually, or just up and down their street. But now we've relaxed a little bit. You could walk in the hills or in a mountain, or you could go along a beach, and you could just say to somebody, "I'm walking 200 kilometers, or I'm walking 500 kilometers over the next month. Would you help me to do that? And this is why we're doing it." And we're sending that money then across, and we're tracking where those donations go. Please do pray for us as well as we do that, because it's a pretty overwhelming task. And we just want to be very wise with how we do it. We think we have a good system, but we're learning all the time. The other thing we're doing as well, John, is and you could really pray for this for us, we're trying to set up a well site. So around a well, how do you do social distancing? How do you clean the equipment? How do you not share jerry cans? How do families avoid spreading COVID? Because there are now cases starting. There's about over 600 cases within the country, and they're starting to creep up. And people coming into those environments potentially are bringing harm, that type of thing. And we're also, if kids go back to school, how do you do social distancing within school well? And we're trying to think about how to set up our schools. So we need help. We need prayer. We haven't done this before. So we're taking all the guidelines and all the right measures, but it's still a first time, so it's a very tough
Yeah.
learning curve. So yeah, we just value any prayer and help in that, please.
Thanks very much. Emily, it sounds like some of the same challenges that we have faced here in Ireland are there across the world, but with a different culture, a different climate, a different sort of a way of life, and the challenges will vary somewhat.
Resources and of course.
Yeah, of course. So Alex, thanks so much. We'll continue to pray for you, the Fields of Life team, and all you through Fields of Life are serving as well. God bless you, and thanks for your time.
Thanks a million.
Cheerio.
God bless you guys. Take care. Bye.